the issue of consultation times, never having enough time, having too much time, having wasted time, having repeat appointments. So we really explored this problem a lot today. And the question we wanted to solve was how can we create creative solutions for consultation planning to use time effectively, meet patient needs, and also make sure that we practice good quality medicine. But the key features is that the patient has a variety of options for how to book their appointment, telephone, in person, or on the website, but the same algorithm is followed each time. One key element, innovation, was to have the opportunity on identifying the problem for the patient to be signposted to effective healthcare education resources and videos that may prevent them from needing to attend. Also that we would ask the patient what kind of service they needed, advice, medication, new problems, complicated problems, review of a chronic disease, and this would help us decide whether they required a telephone call or what kind of length of consultation they needed. Then we also wanted the patient to attempt to triage their own problems slightly. We realized that in some cases all patients were asked for today, at which point the doctors become involved in the triage, but they could choose today, within 3 days, or within 2 weeks. Also, whether or not they're affected by age or mobility and able to attend the clinic, so whether you need a home visit or not. Okay, what kind of problem do you have? What kind of symptoms?
I'm losing a lot of liquid.
From the back passage? We have an information video about that if you'd like to find out.
So, our solution. Our solution is to create a campaign with social media like YouTube or Facebook or Instagram or what else, in order to remove barriers and to increase the quality and also the number of rural doctors in the rural area.
So the principle how we want to design this campaign is it has to transmit the positive image and the positive aspects of rural medicine to the people, so they see that this is actually a career that is attractive and interesting and exciting.
Before we started off, you would think, how do you increase the number of doctors in rural family medicine to end up having a social media campaign targeted at mid to late teenagers to motivate and inspire them to attain the dreams they might have had of being a doctor, and work in rural family medicine is a million miles from where you start off. And I think that shows the power of design thinking to make people think outside the box, think laterally, and arrive at very innovative solutions. And that was just with a group of doctors. I think if we had patients and engineers and artists and public involved, that you would probably come up with some even more innovative solutions. So that was Group Crocodile's work, and maybe you'll see us on YouTube, who knows. Thank you.
The challenge was communication problems between different healthcare providers, between nurses, specialists, GPs, and so on and so on.
That's why we needed a haiku poem for Portugal's health system. So, people are dying, save national health system. We need to act now. Politicians kill, people can't pay for healthcare. We need to act now. Doctors can't treat well, mortality increasing. We need to act now. Doctors frustrated, drugs and gloves. We are in need. We need to act now. Newborns are dying. People are immigrating. We need to act now. United Doctors, coordinated attack. We need to act now. Find internal groups, social events will gather. We need to act now. Make the world see us. Influential people, we need to act now.